or definite diagnosis, not just a differential diagnosis, to reach to a definite diagnosis in that individual case, in every individual case, and try to tailor or give the best treatment or the best therapeutic options which can help this patient. Why there are still mistakes and there are still problems, or what we call challenges in diagnosis and or treatment? Because of many things. Because of the pressure, maybe, the put on the physician, because of the lack of what we call the problems related to clinical inertia, physician inertia, patient inertia, etc. Because of problems related to the factors affecting the clinical skills, which I talked about them in the last year in many of my presentations, in the clinical thinking, in the clinical observation, in the clinical listening, etc., during the history-taking process, and then during physical examination, which are the most important two steps. First, history-taking, and then physical or bedside examination, in order to reach a primary clinical diagnosis, bedside diagnosis, and then ask for investigations or tailor investigations for every individual case, depending on his problem or her problem, in order to reach to the diagnosis and then to decide about the treatment or take clinical decision about the treatment of the patient after reaching to the proper diagnosis or the definite diagnosis of the case. Still, we are meeting problems. There is clinical atmosphere is not good. The environment and the conditions under which the doctors or the physicians or the surgeons are working are not healthy by themselves. General atmosphere, the general environment, the stress, and this is very important, the stress. Doctors are in a hurry to reach diagnosis because they are pressed by too much or too many cases waiting for the doctor to see, whether in the outpatient department or the clinics or in the emergency rooms sometimes. That is both affecting both the acute medicine and in chronic medicine or chronic medical practice. In both conditions, the physicians are under stress for many reasons. And this, the physician or the surgeon being a human is affected or are affected, they are affected by pressures, they are affected by the conditions of the working environment and the atmosphere of the working environment, whether in primary care or secondary care or tertiary care, whether in hospital or in a polyclinic or in a medical center, although the conditions in these different medical facilities or healthcare facilities, they are different, whether hospital or a clinic or in medical center. But the physician under any condition should carry on the clinical process regarding the clinical management of the patient smoothly and easily, and being calm and focusing and understanding in order to reach to the proper clinical decision, diagnosis and treatment of the patient or the healthcare consumer. This is very important, and we have all to remember this. Let us postpone the details of these issues in my next presentation, live broadcasting also. Thank you so much, and I will meet you again in another presentation regarding challenges in modern clinical practice met with by healthcare professionals, doctors, physicians, and surgeons. Thank you so much. Professor Dr. Tariq Ali.